Hey, it's Dr. Seibold here out of Hormone Health, Utah. Recently, I've had a number of women come into my practice with concerns about hormonal dysfunction. So I thought I'd take a minute to talk with you about what that might look like and how we might approach that from a functional medicine perspective. Traditionally, hormonal dysfunction can actually occur at any time in life. It's not just my older women who are going through the change or who have been or who are considered postmenopausal. Often this can involve younger women. Even women down in their early 20s and teen years can be experiencing hormonal dysfunction. Hormone dysfunction commonly manifests as symptoms such as increased or heavy menstrual bleeding, increased menstrual cramping, maybe moodiness around the time of your cycle each month. It could manifest as infertility or possibly as endometriosis or uterine fibroids. Maybe it's just that your energy levels are low or that you struggle with brain fog. Another common symptom can be irritable bowel syndrome type symptoms such as constipation or diarrhea or bloating or some nausea. All these are different ways in which hormonal imbalance can manifest, and there's others. Traditionally, the approach is to look at starting you on an oral contraceptive pill or a serotonin reuptake inhibitor, or maybe more advanced practitioners might consider adding some herbal or botanical supplements to help you control symptoms. And sometimes even surgery is what gets recommended to help control. The important thing to understand is that these approaches generally do not address the root cause of the hormonal dysfunction. And that's where functional medicine really excels. We look to help you understand why this is actually happening. Why are you experiencing these symptoms, not just leave you with treatment to manage them for the rest of life. Some common causes of root causes of hormonal imbalance might include an increase of adipose tissue, or maybe you have some insulin resistance. Potentially you have a chronic infection or just chronic inflammation in your body. It also may be due to a lifestyle problem such as alcohol use or not getting enough sleep and just having poor energy levels. We understand that women, especially who've been through traumatic events in life, often can have physical health consequences related to their hormones. I think the important thing to understand is that there is a root cause driving it, and that here at Hormone Health, we look to address that root cause with you, help you identify that and fix that while we still manage the downstream symptoms. So if you feel like we could be of help to you, if you may have questions or concerns about some of these symptoms, please call, schedule an appointment today, and let us help you out.
Hi, Dr. Saxena here, Chief Medical Officer at Hormone Health. Thanks for visiting our channel. Make sure to subscribe to get the latest insights and information on functional and integrative medicine.